Hey, everybody, this is Dr. John McAtamney. We have another contribution we're doing. It's uncertainty. So let me just open it up. Okay, you can see my screen. The best definition of certainty that I've ever heard is by David Jackson, where he said, certainty is your mind fastened to a purpose. Your mind fastened to a purpose. Let that sink in a little bit. Certainty, fastened to a purpose. A lack of certainty, without certainty, we suffer doubt, distrust, and ambiguity. And that's a really dangerous place for chiropractors to be. The other thing to understand is chiropractic is a three-legged stool. Now, what are we talking about? Our philosophy, our art, and science. So let's get into it a little bit. Chiropractic is a science, art, and philosophy, and is complete as a method of health care. It asks different questions, and that's why. It's different than medicine. Science is the way to investigate and prove or disprove our postulates. Philosophy is the thought process behind the science. Well, we need to drop the keys. We got to get down to this. A lack of certainty is killing your practice and your influence in your community. There's more science behind your profession than you think. A lack of certainty or even false certainty will eat your practice from the inside out. Your numbers, stats, revenue, and influence will be up and down until you can solve this once and for all. And negatively affects you and your practice, your income, your family, your community, and most important, our profession. So let's deal with this head on and watch what happens in every aspect of your life. I want you to know how powerful you are and how big a difference you make in all your patients and community in the world. Every human in your community needs to hear your message and experience your care. A lack of certainty is killing your practice and your influence in the community. You know that? You really understand that? If you don't step out, people are dying. They're on drugs. They're being bought into the medical model, which is based on fear. Now, I'm not saying medicine is not necessary, but people need more than that. Do you know? Do they know that you know? Are you able to boldly tell them without feeling uncertain or like a dirty car salesman? Let's help out with that a little bit. The times are changing. Think about this. Decades ago, the majority of chiropractors entered the profession because they had what would be described as a chiropractic miracle. Either way, they experienced it themselves or a close friend or family member had experienced it. Let me tell you what happens when you experience or witness a miracle type of healing. You don't really need the science to believe in it. So our profession was filled with chiropractic students who got into chiropractic already believing that chiropractic was something more than the average public thought it was. That laid the groundwork for these chiropractors to view and communicate chiropractic to their community and their practice. Flash forward 20 years later, more students are getting into chiropractic because it's a profession to make a good living while helping people. Well, not a bad reason, but it's hard. Now there's nothing wrong with this except that when a student enters chiropractic college, they will have to accept chiropractic whatever the professors say it is. And if chiropractic students never experience anything outside of what the school teaches, they usually miss the very foundational principles in science that prove what we do is essential to patient health and not just an alternative to traditional medicine. Science is king, and BJ knew that all the way back in the 40s. Let me share this short story about BJ and then let's dive in. There was a time in the 40s when another chiropractic school, put out a press release stating that there was no way a vertebra could be misaligned enough to interfere with the nervous system based on cadaver studies. Many medical doctors and professors agreed with this and helped them clarify their opinions that chiropractors are quacks. When B.J. Palmer saw this, he was obviously upset, and his response wasn't about getting angry as much as getting it to work. He knew that the argument was that they had studied cadavers that determined the vertebra would have to fracture in order to actually be far enough out of alignment to put pressure on the brainstem or the nerves. Well, he contacted morticians in Iowa to get permission to analyze newly deceased cadavers within a short period of time after death. Unfortunately, there were laws in place that would not allow that to happen, so he tried the state of New York, but that was the same. He found a lab in Dresden, Germany that would allow for such a thing, and he flew over there and spent time with two doctors as they were able to. Analyzed the brainstem, spinal canal, nerve branches, and vertebral foramen on newly deceased specimens. He made the observation and thus the conclusion that without a doubt, a misalignment vertebra can interfere with the transmission of nerve impulses. Based upon the fact that within 24 hours of death, the brain and nervous tissue shrink between 40 to 50%. Formaldehyde used for preservation also caused soft tissue nerve shrinkage. Some cadavers were not analyzed for up to 18 months after death. And at that point, the average shrinking of bone is almost 1%, but the soft tissue nerve can be greater than 40 to 50% shrinkage. So if you do the math, if someone was only to analyze cadavers weeks to months after death, they would have to make the conclusion that they had essentially disproved the mechanism of why chiropractic work. That's the idea behind the entire profession of chiropractic. My point in telling this story was the willingness of BJ to seek, find, test, and report the truth about chiropractic. The same should be done today. And we know more about neurophysiology than ever, and this adds to the power of chiropractic. This is a poster made by Dan Sullivan a couple years ago that takes all of the research that we have about subluxation and what it does to the nervous system. So you can basically have it in your office, and you can use it for yourself or to convince your patients. But it helps you to know why chiropractic is so powerful. Because every single day you're subluxated, you're shortened of your life potential. So here's a simple question. Would you rather have a back problem or a brain problem? Remember, a back problem is a brain problem. Subluxation is an interference in the brain and central nervous system from a vertebrae not aligned and moving properly. Your health potential is reduced when you're subluxated. There's a number of different studies we're going to get into, but a back problem is a brain problem. The spinal cord is the organizer of disease process. The first study that I believe all chiropractors should know about the work of PhD neurophysiologist Irvin Kaur. Dr. Kaur spent 5 decades of his life studying the spine and its direct influence on the nervous system. In 1976, he published a series of papers with many references pointing to the fact that an alteration in a segment of area of the spine absolutely negatively affected nervous system function. The article was titled, "The Spinal Cord as the Organizer of Disease Processes." Whoa. Kaur said the brain had 90% of its connections within the musculoskeletal system. Do you hear that, chiropractors? The spinal structure of the body have 90% of the connections to the brain and the nervous system. Kaur helped prove that the spine was much more than just a structure to help us stand more erect and protected the spinal cord. He was also unique and inspiring, as he always pointed out that we as humans express our humanness by choosing to do such things as playing the piano, skiing and walking, etc. He pointed out the importance of taking care of the whole person in healthcare instead of the reductionist viewpoint of picking out just the disease organ part like the allopathic physicians practiced. The bottom line of the work of Kaur was how he showed that a vertebral subluxation creates a stress that causes an increased tone. There's that word tone again. In the sympathetic nervous system, sets off a cascade of autonomic processes as if the body was being attacked. This increased tone, that's the DD word again, leads to what we know about the flight or fight behavioral physiology. Here's the thing. It's a good response that helps you in an acute situation, but will kill you chronically. What I mean by that is the short-term situation is good, but if it stays there long-term, it'll destroy the body. This increased sympathetic tone increases stress hormones known as catecholamines, adrenaline, noradrenaline, and decreases relaxin hormones such as serotonin and relaxin. Like I said, this is good for a short time to help you fight or flee from a predator, but when it's sustained for a long duration, it destroys the body. From decreased immunity and digestion to shutting down fertility, focus and attention and energy, this state of physiology is not what any healthy human would experience or should experience for any sustained period of time. Here's another study. Brain changes in men after chiropractic care. A study performed in 2011 revealed the impact of one single adjustment can have on the tone of the nervous system. This is a top-shelf article that all chiropractors must have. Published in the Alternative Therapies Health Medicine, a Guru study was done by 8 PhDs and 1 chiropractor using a PET scan as a powerful neural imaging technique where they measured the neuronal activity of the brain. They were able to take a radioactive analog of glucose as a marker to measure brain glucose consumption, as would indicate brain metabolic activity post-adjustment. The findings were astonishing. The study clearly demonstrated that the sympathetic tone of the nervous system was inhibited, salivary amylase decreased, creating a decrease in flight physiology. Regional brain metabolic changes occurred, and muscle tone and pain intensity decreased after one single adjustment. Let me tell you what this means. I would argue this was D.D. Palmer referred to when he said health is all about tone, and we chiropractors affect tone when we adjust. Increased sympathetic tone always increases stress hormones because the direct link from the spinal mechanoreceptors to the lamina 7 of the spinal cord and up to the cerebellum, thalamus, cortex, and then the hypothalamus as the spine has the only direct link to the hypothalamus and its hormones in the entire body. Cortical spinal tracts. Let me tell you, the spine is one of the most important structures the body must be cared from birth to death, and for more reasons than you think. Chronic increased stress hormones linked through numerous studies directly to a host of disease, including but not limited to cancer, glaucoma, bipolar disorders, type 1 and type 2 diabetes, rheumatoid arthritis, autoimmune disease, osteoarthritis, excessive body weight, hypertension, asthma, immune system function. Autonomic and Autocold Pharmacology, 2009. Are you seeing how the big deal of a single adjustment, chiropractic adjustment is? Another study, cervical spine alters the brain in asymptomatic patients. 2007 from the Journal of Neurophysiology. This was done one of Dr. Heidi Havoc studies, where they basically showed a clear cervical spinal adjustment on patients with no pain influences the cortical brain and can create neuroplastic changes in the brain. That is huge. There are counselors and emotional modification programs that cannot create neuroplastic change in the brain over months and months of therapy, like one single chiropractic adjustment can. I believe the best part of this study is that subjects received adjustments did not have neck pain, but had confirmed vertebral subluxations. In other words, subluxation is not about pain. How many of the people in your community know that subluxation creates abnormal brain physiology without causing any unknown symptoms? The adjustment they received had a direct influence on sensory input and resulted in attenuated brain cortical evoked responses. This means it changed their brain for the better. It was noted that enhanced activity inhibition of the sympathetic nervous system tone occurred in all post-adjustment measurements. The other cool thing, it proved that it was clearly not a placebo effect or laying on of hands. One group was set up for adjustment, but the HVL thrust was not made, and this group had no cortical neuroplastic changes. The bottom line is that the vertebral subluxation leads to a bombardment to the central nervous system with afferent signals from joints and surrounding muscles. A chiropractic adjustment reduces excessive signals and improves altered input into the CNS, resulting in better adaptation to any internal or external input the brain perceives. Know this: how to improve brain adaptability is one of the most important areas of study today in all healthcare, and nobody affects it like you do with a chiropractic adjustment. Chiropractic adjustment removes interference to the nervous system and improves brain function. It does this by improving spinal integrity and through improving segmental motions in subluxated areas. It's all about the nervous system, and chiropractors are the only doctors addressing this. Also noted was that the chiropractic adjustment inhibited the CNS facilitation while producing brain changes, and did it with the patients that had confirmed subluxation but no pain. This is why every human should be checked and adjusted if necessary throughout life by a chiropractor, regardless of symptoms. Here's my takeaway. There's no way to be healthy without a healthy spine. There's no way to know if you have a healthy spine unless you're checked, regardless of pain or symptoms. The health of your body is dependent on your health of your spine. There are reasons backed by science why you and everyone in your family should have chiropractic from birth to death. Number 4, the next study I want to cover is one of my favorites, a study published in the reputable medical journal of Spine 2005, done by a team of all medical doctors headed by Dr. Stephen Glassman. They measured posture in 752 subjects from the sagittal plane using full spine x-rays. They took measurements from C7 and took plumb line measurements as relates to the sacrum. Their findings were astonishing. All measurements showed significantly poorer scores as posture deviations increased. Every minor forward head posture was known to be detrimental. From breathing and heart rate to pain and disability, all health markers that were measured worsened as the posture deviations increased. So as they became more kyphotic, all health markers measured worsened. This again demonstrates the relationship between a bad spine, vertebral subluxation, and its implications on human health, particularly as it relates to non-musculoskeletal physiology. All adjustments help to restore posture by improving motion and spinal integrity, which improves afferent input into the spinal cord and brain, thus allowing the body to comprehend and balance itself better in relation to gravity. Subluxation plays a major role in bad posture, and this study reveals the detrimental effects of deviated posture in a human. The 5th study, Journal of Manual Medicine, published in June of '92. Critical piece of understand why it relates to infants and children. The study showed more than 600 children or less than 2 years of age They referred to the subluxation as a kinematic imbalance due to suboccipital strain. The report talked about a pathogenic importance of asymmetric posture in small children, and the fact is often played down if you recognize it all by the medical community. You and your community need to understand this. The kids don't grow out of this. This KISS syndrome had a wide range of clinical signs, and in many cases can be dealt with effectively with manual therapy. The risk factors for why these children had KISS syndrome, as they call it, were for intrauterine misalignment, application of extraction aids in delivery, prolonged labor, and or multiple fetuses. Birth was the cause of the KISS. Kinematic imbalance and suboccipital strain. Vertebral subluxation of the upper cervicals. This is the study you definitely want to know about and have certainty with, as it is proof why infants and kids need chiropractic. Let's look at the facts. They agree that the main symptoms of KISS syndrome can lead to torticollis, unilateral face asymmetry, T-scoliosis, motor asymmetries, unilateral retarded maturation of the hip joints, slowed motor development, sleeping disorders, neck sensitivity, face swelling, fever of unknown origin, loss of appetite, feet deformities, pathological reflexes, range of motion diminished by 30% or more, and the parent reported baby does not eat or drink well. Wow. They concluded that these babies on an A to P radiograph of the upper cervical spine is imperative. The radiograph evaluation helps to find malformations and aids in determining the direction of the adjustment. A to P radiograph of the upper cervical spine in newborns. There was no correlation between the extent of the asymmetry and the symptoms or success of the treatment. This means that even a small subluxation is clinically relevant. The treatment involved an impulse adjustment, and in most cases, the direction and line of the drive was determined by the radiological findings 85% of the time. There are huge findings in this study. Selection of the direction of the adjustment without x-rays seems the most plausible cause of the less encouraging results of some colleagues. This means the x-rays help get better results. Interesting. The risk of treatment was minimal. No serious complications were encountered. Most children would cry for a moment, but stopped as soon as they were in their mother's arms. In 2 cases out of 600, the children vomited after the adjustment, but had no negative effective outcome in either case. It was noted that the upper cervical spine remains weak spot in most children, which is why they should be re-examined before they start school at age 6. KISS is not confined to local complaints or even mechanical symptoms, and is not taken into account when these children show signs of restlessness and concentration difficulties. As a pediatric chiropractor, I see this all the time. Upper cervical subluxations cause a tremendous amount of restlessness and concentration difficulties. So do you hear that? Subluxations may not have symptoms. Unfortunately, with kids with issues such as restlessness and attention issues, ADHD, the subluxation is typically not considered to be a cause, but it is. The author noted that babies with a contracted sternocleidomastoid muscle should not be subjected to operative measures to lengthen muscle because they would nearly always respond to adjustment of the upper cervical spine. Yeah, the measurement of the operative treatment is basically cut the sternocleidomastoid muscle, slice it so that the kid can turn his head. Upper cervical delicate structures undergo considerable stress during delivery, and during delivery, a majority of newborns suffer from microtrauma of the brainstem tissues in the periventricular area. Birth is usually a cause of subluxation. Another interesting side note from this study is that the adjustment of the occipital cervical region led to disappearance of the problems that the parents had not reported because they did not see a connection with the spine. We hear this all the time in practice. Go to the upper cervical spine and the constipation clears up. The kid goes to the bathroom. These parents would regularly note their children would eat or sleep much better since the treatment. It's a great study that every chiropractor should have. Many people may ask why children need to be checked by a chiropractor, why someone with no symptoms would go to a chiropractor, where did all the problems on my spine come from? And this study explains all of that and more. This article alone is a game changer for humanity. If you were born, you need to be checked by a chiropractor to ensure optimal spinal integrity and brain-body connection, period. The 6th study all chiropractors should have and know about comes out of JMPT in 2007. Self-explanatory study the benefits of long-term care. Some people say, I won't go to chiropractic because once I heard you have to keep going. How many heard that one before? I can tell you with confidence the best part of chiropractic is that once you start into care, you can keep going. And the benefits of continued care just get better and better. It's our unique advantage, not a disadvantage. It's like wine. It gets better over time. You need to be certain about that, and I'll show you why. The study observed health statistics of people over a period of time whose PCP were conventional medical doctors compared to those who had the PCP as doctors of chiropractic. Clinical and cost utilization based on 70,000 member, right, large amount of time and people studied over a 7-year period, demonstrated decreases of 60.2% in hospital admissions, 59% less hospital days, 62% less outpatient surgeries and procedures, and 85% less pharmaceutical costs in those who had chiropractors as a PCP when compared to the conventional medical doctor as a PCP in the same geography and time frame. Those with chiropractors for PCP had 60% less hospital admissions, 62% less surgeries, 59% less days in hospital, and 85% less pharmaceutical costs. Let that sink in, people. There's ample science and evidence to support the power of chiropractic adjustment. The physiology behind a vertebral subluxation is much more than just a hard bone on a certain nerve. It virtually affects every aspect of human function. The power of an adjustment has been proven to be more effective for improving visceral pathology and physiology than musculoskeletal health. Every human should be evaluated and have their spine cared for by a chiropractor over a lifetime. And the best part of chiropractic is that it can be utilized over a lifetime, and the evidence supports that the greatest benefits are received with frequent ongoing care. Lifetime care, not the treatment of disease. BJ said this: we chiropractors work with the subtle substance of the soul. We release the prisoned impulse, the tiny rivulet of force that emanates from the mind and flows over the nerves to the cells, stirs them to life. We deal with the magic power that transforms common food into living, loving, thinking clay that robes the earth with beauty and hues and scents the flowers of the glory of the air. In the dim, dark, distant long ago, when the sun first bowed to the morning star, this power spoke and there was life. It quickened the slime of the sea and the dust of the air, and drove the cell to union with its fellows in countless living forms. Through eons of time, it finned the fish and winged the bird and fanged the beast. Endlessly it worked, evolving its forms until it produced the crowning glory of them all. With tireless energy, it blows the bubble of each individual life, and then silently, relentlessly, dissolves the form and absorbs the spirit into itself again. And yet you ask, can chiropractic cure appendix or the flu? Have you more faith in a knife or a spoonful of medicine than in the innate power that animates the internal living world? These are the references we talked about today. Take a picture of it, get a hold of these studies, make sure you read them. A couple of bonuses in there. Atlas vertebral alignment, achievement of arterial pressure goal in hypertensive patients. Second bonus, hyperkyphotic posture predicts mortality in older community dwelling men and women. A lot of this research was put together by Dr. Dan Sullivan. I want to acknowledge him for the information I have. There's a booklet about this that you can reach out to me for if you want. My email is drmccontamini@gmail.com. And I encourage all you to check out the Chiropractic Advocate website for more information. Have an awesome day. Thank you for coming today, and I wish you the best.